pulling the wrong teeth, ignoring patient pain, and failing to follow proper sterilization protocols. Those are just some of the findings against an oral surgeon in Lewiston.
Dr. Jan Kipax is practicing again after finishing his most recent suspension from the Maine Board of Dental Practice, his third on record. We spoke to a former patient of his who went to have 2 teeth removed last year. She says what happened to her during and after her surgery is part of an investigation against him. Watching her son Nico play brings a smile to Megan Westervelt's face. Her visit to an oral surgeon last year brought the opposite reaction.
There's no way. There's no way this just happened.
She went to Dr. Jan Kipax to have 2 teeth removed. Kipax was one of the only dentists nearby who accepts Maine care and who could get her in for an appointment quickly.
He informed me that he felt I needed to have 4 teeth extracted, not 2.
Westervelt opted for general anesthesia. When she woke up, she says her mouth was a mess.
I woke up choking and coughing on my own blood. There was no gauze in my mouth, no stitches.
She got home and looked in the mirror. It was worse than she feared.
It wasn't just 4 teeth he pulled, it was 5. And I discovered he pulled, the wrong one and had also chipped a tooth in the process.
Westervelt filed a complaint with the Maine Board of Dental Practice, claiming Dr. Kipax pulled the wrong tooth, provided no stitches or gauze, and prescribed inadequate medicine to deal with the pain.
You go under anesthesia, there's a great deal of trust. And it's, you feel violated.
In line with board procedures, Dr. Kipax responded to Westervelt's complaint, writing that he told her he felt she needed 5 teeth pulled and believes he pulled the correct teeth. He also states he believes stitches were not necessary because the extractions were not surgical, but simple. He also wrote gauze would not be an appropriate treatment. Westervelt's complaint isn't the first against Dr. Kipax. News Center found 3 disciplinary actions taken against him. A 2002 suspension of his license stemmed from a laundry list of complaints, including that Dr. Kipax did not wash his hands between surgeries, wore gloves contaminated with patient blood and/or saliva when touching sterilized dental instruments, and even dropped sterilized dental instruments on the operatory floor and reused them in patients' mouths without properly sterilizing them, as well as extracted the wrong tooth, dropped it on the floor, rinsed the tooth with water, and unsuccessfully attempted to reinsert that tooth back in the patient's mouth, as well as not properly addressing patients' pain. A 2003 suspension of his license came from similar complaints, removing the wrong teeth and failing to properly assess patient complaints of pain. On February 17 of this year, the dental board investigated another series of complaints, including Westervelt's, which was part of a list that accused Dr. Kipax of continuing with painful procedures after patients asked him to stop, failing to provide patients with appropriate aftercare instructions, performing procedures while not wearing gloves or not changing contaminated gloves, and extracting teeth other than those intended to be extracted. Kipax's license was suspended for 30 days. He's now practicing again.
It's incredibly frustrating to see someone continue his practice when it's a joke.
We called Dr. Kipax's office for a comment twice.
Chris, thank you for calling. Goodbye.
We also called Kipax's lawyer, James Bello, and left 3 voicemails and sent 4 emails, but got no response. There's one question specifically for the dental board that we wanted answered. After numerous complaints and disciplinary actions, what does it take for a dentist to get his or her license revoked for good? Our request for an in-person interview with the dental board was denied because the spokesperson felt it was inappropriate for staff and board members to be interviewed when involved with ongoing potential investigations and complaint cases. So we emailed our questions. Executive Director of the board, Penny Valancourt, responded saying, "The board may consider previous discipline with similar conduct or violations when imposing sanctions. The board can consider a variety of sanctions, including revocation, for any violation enumerated in statute. As noted earlier, each case presents a different set of facts, and sanctions are imposed relative and appropriate to the unprofessional conduct or incompetent practice violations as determined by the board. Dr. Kipax is still able to practice in Maine.
Kitty?
Westervelt says it isn't
He
right.
needs to have his license revoked. There is no way this man should be practicing. Absolutely not.
There's an effort right now to organize a class action lawsuit against Dr. Kipax. The dental board has yet to respond to our follow-up questions about when the complaints against the dentist are grounds for losing his or her license.